How to treat and cure snoring. Snoring is caused by a narrowing of the upper airway during sleep. This can be due to large tonsils, a soft palate, a long uvula, or excessive flabby tissue at the throat. All of these areas relax during sleep. In other cases, nasal congestion from allergies or deformities of the cartilage between the two sides of the nose can contribute to narrowing of the airway. However, the most common cause of narrowing of the upper airway is a tongue muscle that becomes too relaxed during sleep. When relaxed, it gets sucked back into the throat with each breath taken. Because snoring occurs when air travels faster through a narrow tube than through a broad one, this rapidly moving air causes the relaxed soft tissues of the throat to vibrate. It is this vibration that creates the sound of snoring. Common causes of snoring: supine body position, lying face up; large tonsils, long soft palate or uvula; a tongue that relaxes too much during sleep; being overweight; nasal congestion from colds, allergies, or deformities of cartilage within the nose; menopause; consuming alcohol, medication, or tobacco products within 6 hours of going to sleep; hypothyroidism. Snoring is the vibration of respiratory structures and the resulting sound due to obstructed air movement during breathing while sleeping. In some cases, the sound may be soft, but in most cases, it can be loud and unpleasant. Snoring during sleep may be a sign, or first alarm, of obstructive sleep apnea, OSA. Researchers say that snoring is a factor of sleep deprivation. National Stop Snoring Week is run by the British Snoring and Sleep Apnea Association. In 2016, the Awareness Week runs from 25 April to 29 April and hopes to help those affected by sleeping with a snorer. Snoring is known to cause sleep deprivation to snorers and those around them, as well as daytime drowsiness, irritability, lack of focus, and decreased libido. It has also been suggested that it can cause significant psychological and social damage to sufferers. Multiple studies reveal a positive correlation between loud snoring and risk of heart attack, about +34% chance, and stroke, about +67% chance. Though snoring is often considered a minor affliction, snorers can sometimes suffer severe impairment of lifestyle. The Between Subjects trial by Armstrong et al. Discovered a statistically significant improvement in marital relations after snoring was surgically corrected. This was confirmed by evidence from Gall et al., Cartwright and Knight and Fitzpatrick et al. New studies associate loud snoring with the development of carotid artery atherosclerosis. Demonstrated that snoring vibrations are transmitted to the carotid artery, identifying a possible mechanism for snoring-associated carotid artery damage and atherosclerotic plaque development. These researchers also found amplification of the snoring energy within the carotid lumen at certain frequencies, adding to this scenario. Vibration of the carotid artery with snoring also lends itself as a potential mechanism for atherosclerotic plaque rupture and consequently ischemic stroke. Researchers also hypothesized that loud snoring could create turbulence in carotid artery blood flow. Generally speaking, increased turbulence irritates blood cells and has previously been implicated as a cause of atherosclerosis. Blockage and is usually due to one of the following: throat weakness, causing the throat to close during sleep; mispositioned jaw, often caused by tension in the muscles; obesity that has caused fat to gather in and around the throat; obstruction in the nasal passageway; obstructive sleep apnea. The tissues at the top of airways touching each other, causing vibrations. Relaxants such as alcohol or other drugs relaxing throat muscles. Sleeping on one's back, which may result in the tongue dropping to the back of the mouth. Almost all treatments for snoring revolve around clearing the blockage in the breathing passage. This is the reason snorers are advised to lose weight, to stop fat from pressing on the throat, stop smoking. Smoking weakens and clogs the throat, and sleep on their side, to prevent the tongue from blocking the throat.